Welcome to this update on using eRS in EMIS Web. All GP to consultant referrals must go through eRS from the 1st of July at St George's and Kingston. Any GP to consultant referrals using any other route will be returned to practices. Here's a contents page. You can download a PDF of these slides at either of these links to Dropbox. Here are the contact details for Wandsworth and Merton CCGs, the phone number and Ian's email. Also the St George's ERS help email. This clip is an update to the one sent out in February and May. Please also see the new NHS Digital video clips. Here's a very useful one focused on 2-week wait referrals. Here's the returns process as it applies to practices if you send a referral by a non-ERS route when it should have gone through ERS. Using ERS first time will avoid extra work and delay. Please ensure the email your practice has given is monitored at least daily. This spreadsheet on St George's website is updated at the beginning of every month. The spreadsheet contains all the clinics published on ERS at St George's. Search by specialty and clinic type to get used to the structure of the directory of services. The clinics excluded from ERS are summarised here. They will appear in detail on the St George's website ERS page. Note the antenatal referral email. This will soon appear on the referral forms. ERS in EMIS in 12 steps. Most patients can book their own appointment online or by phone. For patients who need the appointment booked for them, see the 12 steps on page 25. 12 steps for 2-week wait is on page 27. For using the referral assessment services where consultants triage referrals, see page 29. If ERS in EMIS is not working, then refer on the ERS webpage, see page 47. Here's the 12 steps for patients who can book their own appointment. Have smart card inserted, check patient contact details, check that the patient demographics are in sync for the blue box, have any referral forms saved in the notes now or before the letter task is started. Steps 1 to 11 take about a minute. Step 1. In EMIS consultation, choose referral, NHSE referral and priority. Step 2. Choose the specialty. Step 3. Choose the clinic type. Step 4. Search all. Step 5. Choose several clinic options. And Step 6. Click Request. Step 7. Quick check of clinic criteria and click Continue. Quick check of patient details and click OK. Step 8. Quick check of the options and click Submit. Step 9. Print appointment request summary with password, or save as a PDF if you or your secretary are going to email the summary to the patient. Here's the appointment summary to give or email to the patient with the booking reference number. The second page has the password. Step 10. Then leave ERS by clicking I have selected a service and press OK when asked to confirm this. Step 11. Then back into EMIS, code the referral with the appropriate referral code and send the letter task to whoever does the letter, either yourself or your secretary. Step 12. Get the letter attached and authorise the e-referral. If you send the letter task to your secretary, then send them dictation or tell them where you've saved the referral letter within EMIS. If sent to yourself, then go to the workflow after the clinic. Here's the 12 steps again for the majority of patients who are able to book their own appointment online or by phone. Here's 12 steps when you need to book the appointment for your patient. The red sections show the differences. The February clip does this in detail. If there are no slots and the patient is not willing to consider other trusts, then click on Defer to Provider and the trust will manage the routine referral within 5 days. Here's the 12 steps adapted to 2-week wait appointments. And again, if there are no slots and the patient is not willing to consider other trusts, click on Defer to Provider and the Trust will manage the 2-week wait referral within 48 hours. The Referral Assessment Service RAS triage option is for referrals to complex pathways or clinics where a workup is essential before the consultant triages and books into a clinic slot appropriate to the needs of the patient. Here are the current referral assessment services at St George's. Also in Wandsworth, the MSK single point of access uses a RAS currently for MyCAS referrals. Physio will be included in the next few months, but remains an emailed referral as mentioned previously. Here's what it looks like. This example is gastro 2-week wait. Click on Send for triage, then click Submit. Process the form or letter as with all other e-referrals. Currently there's not a sheet to print out for the patient. NHS Digital have said this will become available in July. Getting the letter completed and attached can be done in 6 steps. Go to the letter task in Workflow Manager in EMIS, Referrals, Pending Letter. Open the letter. If using the eRS letter template, then add clinical content very similar to the standard EMIS letter template, adding in consultations, problem headings, results, and you can add attachments including any referral forms you've just completed for this referral. Then either add letter text or state see attached referral form, which you can add via clinical content attachments, or click Add Referral to attach an EMIS referral letter, which many secretaries will do, and the EMIS letter templates appear. Here's how to add any referral form, including a 2-week wait referral form that has been saved into the EMIS notes. Just click the attachment. You can add any previous scanned letters also, especially useful if the consultant won't have access to previous letters. Then authorize and send. The e-referral is now complete. The booking reference number is now displayed in the consultation notes. Make sure somebody in the practice is checking the work list on the ERS website at least daily in case referrals get rejected or need some additional action. You can go directly to the ERS website using this icon on the EMIS Quick Start toolbar. Use the drop-down arrow at the end of the toolbar to configure it. It's the icon with the pale and dark blue heads. Here's the work list page looking at referrals that say action is required. I'm just looking at my own referrals here, but it's possible to view all in the practice, which must be done daily, and any action taken from the messages by clicking on the reference numbers. Very occasionally, a patient may not yet have an NHS number. If this is the case, you can refer using the generic St George's central booking emails stating this reason. This route will also be used if ever the whole ERS system is not working. However, if there's an error message within EMIS and the patient has an NHS number, you can refer using the ERS website. Here's how to refer on the ERS website in 12 steps. The beginning and the end are different, but most steps are the same as when using ERS through EMIS. You need to save any letters, forms, or other attachments in a folder on your PC. Paste the NHS number and click Search. To copy the NHS number from EMIS, right-click on the dark blue band, select Copy Details, and select NHS number and click Copy to Clipboard. Click on Refer. Choose the priority, specialty, clinic type, and search all as before. The remainder of the process is the same as before, but you click on Add Referral Letter to add any form, letter, or other attachment, and select from where you have saved them on your PC. This process doesn't enter the details or booking reference number into EMIS, so you have to make your own entry. As with all referrals, you can check the history or view the request by clicking on the booking reference number. Please don't hesitate to contact Ian and I through Ian's email on page 3, and if helpful, download these slides on the links on page 2. Thank you for listening.